Hi friends, moving on with the next topic in the MSK Radiology. This is again one of the most important topics from the exam point of view and including your practicals and theory both. Okay. Uh, it's very obvious that one of you will definitely be receiving either a short case or a long case on bone tumors. Okay. So the thing which they test in the practical exams in the cases of bone tumors is how you approach a case of bone tumor and then how do you reach your differentials. Okay. So I have divided these lectures into three parts. Okay. In today's lecture, we'll be just discussing that what are the parameters on which a bone lesion is assessed and how do you reach that whether it is a benign lesion or an indeterminate lesion or an aggressive lesion. Okay, so these are the three terms which you should be using in your exams for a bone lesion. Please do not straight away jump to a diagnosis. Okay, in your exams. Okay, it's always better to give few differentials. Okay, and if you're not sure of the differentials, okay, so the first point, what you say, it's a benign looking lesion or an indeterminate lesion or an aggressive looking lesion. Okay, so these are the three terms which you should be using in your exams. And how will you reach that term? We'll be discussing all those parameters in today's class. Okay, so please listen carefully. Any evaluation always starts by a preliminary analysis. Preliminary analysis includes your age of the patient, gender of the patient, whether the films which have been provided to you are of a single lesion or whether they show multiple lesions in different bones, and what is the symmetry of the lesions if multiple films have been provided to you. Okay, so you can have n number of cases, okay, for a bone lesion. Okay, so it's not only about the bone tumors. We have some tumor like processes, like we have brown tumor in cases of hyperparathyroidism. That could be just a case. Okay, somebody can bring you just a case of geod. Okay, and then you can have your whole viva on bone tumors just by having a x-ray of a geod. Okay, so you should be very clear with your basically your points and how do you approach that lesion. Okay, so the approach which I'll be telling you today, okay, is relevant for any bone lesion. Okay, and after that you can say that it's a benign looking lesion or a aggressive looking lesion. Okay, even your infective lesions can be aggressive looking lesions. They can, not only the bone tumors are aggressive looking lesions, your infections can also be your infective basically your infections can also be your aggressive lesions. Okay, so if I say that it's an aggressive looking lesion, I'm not ruling out that infection cannot be there. Infection can still be there as a differential. Okay. Okay. No matter the age group, infection can still be there as a differential. Okay? So that is why it's always safe to say it's an aggressive looking lesion. Do not say that it's a neoplastic lesion. Okay. So whenever you're talking about bone tumors, use these three terminologies: benign, indeterminate, and aggressive. Okay. So let us start with today's lecture. So enough of prep talk. Okay. We start with the preliminary analysis. As I told you, you start with the age, gender, okay, whether it's a mature skeleton or an immature skeleton. Okay. Then you see how many films have been provided to you, whether it's a single lesion, for example, it's a single enchondroma, or if it's multiple lesion, like it's an Ollier disease, which is multiple enchondromatosis. Okay. Then you see the symmetry of the lesions. If it's a systemic disease like hyperparathyroidism, they're usually symmetrical. Okay. And if it's like a metastatic disease, they're usually haphazard. Okay. This is our main table. Okay. You have to keep this table in your pockets, in your phone as a screenshot. Okay. And whenever you are evaluating any bone lesion, you have to see through all these points. Okay. Then we have certain supplementary analysis. Other radiological procedures include your CT, MR, okay, or nuclear scans. Okay. But for your exams, okay, only and only radiographs are essential for diagnosing of a bone tumor. Okay. There are very few indications for MR. Okay, we'll discuss in the next class. But for now, if somebody asks you what is the main investigation to be done in a case of bone tumor, you will just say it's a radiograph. Okay, nothing else. Then we can have certain lab examination like alkaline phosphatase levels, and then we can have confirmatory biopsies as well. Okay, we start with the preliminary analysis. As I told you, age is the number one thing. Okay. There are certain tumors which are common in a certain age group. Okay. I'm not saying these are only seen in that age group. Okay, please carefully listen to my words. Certain tumors are common in certain age group. Okay, means they are uncommon in another age group. Okay, so mature and immature skeleton. Okay, there are many books which divide these according to the ages. Okay, but you should be just that what tumors are basically common in which age. Okay, so if you see that most primary bone tumors, they are seen in patients who are under 30 years of age. And if you are getting a patient over 30 years, always keep MITS and myeloma as a differential in the back of your mind. Okay. If you see that bone tumors, which are like primary bone tumors like osteosarcoma, Ewing's, ABC, they're more common in patients who are young, less than 20 years of age. And there are certain tumors which need to be kept in the differential. Okay. Obviously, according to the picture, like your MITS, multiple myeloma, once the age is more than 50 years. These are the things which you must be getting on day-to-day basis, but you need not remember that each and everything. You just need to be sure that uh, in certain cases where the age will be important, I'll be telling you. Okay. Otherwise, you should be just having a broad view that which tumors are more common in which age group. Okay. But please keep your mind open. These tumors can be seen in the other part of age group also. I'm just saying these are common in a certain age group, means they're uncommon and not absent in the other age group. Okay. So if you look at the age group which is less than 30 years, you see that most of the primary bone tumors like fibrous dysplasia, Ewing's, non-ossified fibroma, the osteosarcomas, chondroblastomas. Okay, so they are seen in less than 30 years of age. Okay, that is your skeletally immature patient. And if you look at more than 30 years, then the differentials like METS, myeloma, lymphoma, they come into the picture. There are certain few primary tumors also which are common on the other side of the age group, which includes your GCT, the giant cell tumor, seen in skeletally mature patients. Then we have enchondromas and chondrosarcomas. Okay. Again, these are also seen in the higher age groups. Okay. Infraction has no barrier. It can be seen either in the less than 20 years, less than 30 years also, more than 30 years also. Okay. Since GEOD is obviously associated with a degenerative joint disease, so it will obviously be associated with a higher age group. Okay. Now these tables have been given. Okay. No need to learn these tables. Okay. You should be just have a broad view that which tumor is common in which of the age groups. Okay. So like you can see, the reason why I put the table is here that even in less than 20 years, giant cell of the tumor, you can see it is written as rare in this age group. It's not absent in this age group. Okay. So you have to keep your mind open while reporting the cases. Okay. If you have features like definitely of that, like of GCT, and still it's not matching the age group, still you have to keep it in that differential. Okay. Don't get bogged down that it's less than 20 years now, GCT cannot be there. Okay. Still it can be there. You have to keep your mind open. Okay. So osteosarcoma, Ewing's, okay, these are again common in less than 20 or 30 years of age group. Okay, three tumors I've told you. One is GCT, enchondroma, and one is your chondrosarcomas. They are on the other side of the age group, which is they're more than 30 years. Okay, so as I say, chondrosarcoma is more common in adults. GCT, the typical occurrence is in more than 20 years of age. Okay, so both of these they occur in the skeletally mature patient. Okay, the counterpart of GCT, which occurs in the skeletally immature patient, is your chondroblastoma. Okay. Again, you can see in this 20 to 50 years of age group, you see that osteosarcoma has been written, but it's lower down the group. Okay. So again, it's more common in elderly patients rather than younger patients. Please excuse me for 2 minutes.